Body fillers. Have you heard about this exciting new treatment that is hitting the Indian markets recently? In this video, I'm going to do a deep dive on what are body fillers, where are they useful, what are the things that you as patients have to be careful about when you're getting them done. Hi, I'm Dr. Saumil Shah. I'm a plastic surgeon, director of plastic surgery at Skin Zone Aesthetics in Borivali, West Mumbai. Body fillers, as their name suggests, are basically fillers that are used for your body. Now, we use fillers for the face, as a lot of you would be aware about. They are to shape and contour and volumize a face. Similarly, in areas of your body which have started looking deficient, or you have genetic problems causing deficiency in a particular area, we use these body fillers. The most common areas where body fillers are used are the hip tips, which are the side of your hips, the back of your hands, and some other areas post, say, a liposuction or some other disease where there are some contour abnormalities in your body where body fillers can be useful. Now, what are these body fillers? These body fillers are the same component of HA like in your face, but they are slightly modified for using it in your body. As the body filler market grows in India, more and more different types of body fillers will start getting introduced into the country. We already have a plethora of body fillers being investigated by different plastic surgeons throughout the country, looking at how they work, where they work, and how good they are. As more and more of these come in, it will be important to understand as to what works, what does not work for us doctors as well. These have been in vogue in the West for a very long time. However, a lot of them do pose a lot of dangers that are hidden with them. One very important thing for all body fillers is something that a lot of women come and ask us about. That is body fillers or injections for breasts. Now the thing is, body fillers for breasts are not something new. Body fillers themselves are not something new. We had body fillers in the market for a very long time earlier. They were used in different areas of the body, of course, but for the breast, it's something that is not very predictable. It's something that can sort of move with time because the breasts are again not a single entity. These fillers are not put into the breast tissue but either above or below the breast tissue, and they can move with gravity and with time as well. So it's very important to know whether there is a particular thing or particular condition in your breast for which you're getting body fillers done. If you're getting it done just for plain augmentation, I for one am still a very big skeptic about whether they really work, and I also believe that they can sometimes cause major complications that are very difficult to correct. There are body fillers that are semi-permanent and permanent as well that are available in the market. We do not use those for the simple reason that they do lead to a lot of inflammation on the body and can sometimes cause major problems where they need to be surgically then removed by giving cuts on your body, which can be a major aesthetic disaster. We don't use things like silicone or directly liquid silicone or oils or other things like that to put it into your body, into your, say, your muscles or your breasts or even the areas like hip dips and your hands, because these are things that are not approved. Whenever we're doing a procedure where we are injecting something into your body, it needs to be tested, it needs to be approved by the regulating facilities, seeing the safety and the efficacy of these things, and then we should also make sure that they are giving results. So these are the few things that we sort of do when doing body fillers. Whenever a new treatment comes in, we have to make sure that we sort of address the side effects, we as doctors address the side effects that these treatments would bring with it. No treatment is devoid of side effects, but we need to know how to deal with them, and we need to know ways to minimize them. Body fillers, like all other treatments, have their side effects. Sometimes they may sort of migrate, sometimes they may go away quicker. These are the things that sort of can be taken care of, especially with temporary fillers. With permanent fillers, the side effects can include things what are called as granulomas or abscesses, where they get infected and form a lump in the body that then needs to be surgically cut and removed, which would leave really bad scars. Sometimes they can't even totally be removed and cause continuous pain and swelling in a particular area. These are a few things that are very common. We don't use fillers such as silicone or liquid silicone or oil or paraffin or things like that, because these things can actually cause major issues where it can lead to deaths. It can lead to things like loss of limbs and other issues when non-approved injectable things are used in the body. Because you have to understand, all of these fillers are one, pre-sterilized. They go through a variety of tests. We know how they are to be used. We as plastic surgeons know where to put them. Again, the surgeon is very important to avoid these side effects as well, as to whom you're getting it done from. And we also know what to do if you do have some side effects. So we especially use only temporary HA fillers that can easily be dissolved if needed, and we don't use fillers that are permanent, semi-permanent or biostimulatory, at least not at present. This was sort of a deep dive into the world of body fillers that is emerging. If you have more questions and if you think that we can add more topics on this, do let us know and we'll make another video on it. It's still an emerging branch and a lot of doctors have started doing it. We too do it, and you can get in touch with us if you want to know more or get a treatment done or get a consultation done. Bye. Thanks.